At this meeting of the traditional midwives in Colombia, I felt so much at home, particularly because I'm a woman and I come from Africa. You know, we experience the same things. We almost have the same history of colonialism, slavery, and poverty. So to find out how women in Colombia and Africa are organizing themselves to support each other in terms of safe motherhood and reducing maternal and child morbidity is quite exhilarating. I'm very, very happy about it. Back home in Nigeria, we are doing about the same thing, but although we are yet to integrate into the health system officially, but we have what we call traditional birth attendants. And government is working with them to see how they can refer cases of birth in the communities that have complications so that they'll refer them to the hospital. So we have a program called the MAMI program, Maternal Neonatal Morbidity Reduction in Innovation Initiative, where we pay women. Women are paid 15,000 to. Sorry, let me recap that. Women are referred to the hospital to go and deliver. And so within a budget of 15,000, the government pays a taxi driver who carries a poor woman to the hospital. The midwife, the local midwife, is paid a stipend of 5,000 naira as she refers a case to the hospital. So you see how government is working indirectly with traditional midwives in Nigeria. Now, we also have another program called the Renew Her Initiative. It's a presidential women's transformation health program whereby women are taught how to take care of themselves. They are taught how to recognize the signs and know where to go and get help. So government is giving health insurance, free health insurance to poor women so that they can go to the hospitals and get medical attention for free, women that are poor. So we are creating advocacy. We also have another program called Saving Our Mothers. So through these three programs, the MAMI program, the Renew Her Initiative, and the Saving Our Mothers program, we are working hand in hand with communities in Nigeria to see how we can bring low-cost care. Women should be able to know where to go, get quality care at the right time that they need it so that we can save their lives. Africa and Colombia, with what APC Colombia has done, bringing 6 African countries, Ethiopia, Togo, Senegal, Nigeria, Ghana, and other countries to Colombia. I think we have already started a very wonderful conversation. So for us to be here, our national government released us to come. So that tells you that we're already having a good bilateral collaboration or relationship with our countries. So I see this going further, particularly by the time we take home our reports to our government to tell them what we have seen and report on all the good and positive aspects of traditional midwifery. I believe that the relationship between Africa and Colombia will be more sustained. Thank you. The message for the world for me is that world governments should prioritize maternal and child health because this is the foundation of life. This is how we sustain our humanity. So it should be prioritized. Government should increase the budget for maternal health, for sexual and reproductive health generally, so that no woman should die because she wants to bring life to this world, right? Because a healthy woman, a healthy child is a healthy nation and a prosperous nation. So governments and countries should put hands together, invest in safe motherhood, invest in sexual and reproductive health systems, and improve on our hospitals. I mean, what will it cost us if we make sure that every equipment or resource that is required in the hospitals to safeguard lives is provided? We have the money, we have the resources. Taxpayers are putting resources out. Let's use the resources judiciously Also, governments of the world should not discard the cultural heritage. I mean, that is why we have UNESCO. So that has been the cultural heritage or traditional midwifery has been recognized in Colombia. I think it's something that other African countries and countries of the world can also adopt, so that we'll see how we can integrate both systems together and make our communities healthy. I mean, going back to basics, to the environment, to sustainable practices, sustainable best practices will help our communities to be healthy and reduce the burden on hospitals. Of course, the workload is already so much for most of our health institutions. So it's good that we integrate all this, teach people how to be healthy, train healthcare workers, establish more midwifery schools, and let people learn how to do these things better. Take this knowledge back home. Like in Nigeria, in one of our states, we have a very good practice that we're doing in Oyo State, Ibadan. So we get the traditional midwives to donate their daughters or give their daughters to the state government. These girls are trained and they go back to help their mothers. So you now see that they have clinical knowledge and they add it to traditional knowledge. It helps everybody to stay alive and sustain life for now. So thank you so much. Thanks for having us from Nigeria. Gracias again.